Hello everyone, today I will explain the overview of point of care testing, also known as POCT. POCT refers to diagnostic testing that is performed at or near the patient instead of sending sample to a centralized laboratory. This approach allows results to be produced quickly, often within minutes. Because of this, POCT is very useful for fast clinical decision making. POCT devices are usually portable, small and simple to use. They require very minimal sample preparation, which means the test can be performed not only by laboratory technologists, but also by nurses, clinicians and even patients at home. Traditional laboratory testing can take hours or even days due to sample transport and processing. POCT overcome these delays by providing quick results, enabling immediate diagnosis and treatment. This rapid feedback improves workflow efficiency, reduce delay in patient care, and support better outcome, particularly in acute or emergency situations. POCT can be used in many different environments such as emergency department, outpatient clinic, ambulance, pharmacies, community healthcare, and home-based care. Some examples of common POCT include blood glucose monitor, pregnancy test, rapid antigen test, cardiac marker test, and urine dipstick. POCT also provides several important benefits. It greatly improves access to diagnostic testing, especially in rural or underserved areas where laboratory facilities may be limited. During emergency or infectious disease outbreak, POCT helps support rapid screening and immediate decision making. However, there are also challenges that must be considered. To ensure the results are reliable, proper accuracy checks, quality control, and operator training are essential. Additionally, POCT devices must be regularly maintained to ensure consistent performance. In summary, POCT significantly improves the speed, efficiency, and accessibility of diagnostic testing. It reduces dependency on centralized laboratories and supports better patient outcomes by allowing healthcare providers to make fast decisions at the point of care.
Today, I'll be explaining the different types of point-of-care testing using microbiology group based on the technology behind them and also the device that are used for it. The first category is rapid diagnostic tests, also known as lateral flow assay. These are the simplest POCT tools, usually in the form of a strip or cassette. They work by detecting antigens or antibodies in samples like blood, urine, or swabs. Examples include influenza antigen test, HIV antibody test, and a COVID-19 antigen kits. The advantage are they are fast, cheap, and widely used. The second category is molecular POCT, which detects the DNA or RNA of pathogens. This test uses PCR or isothermal amplification methods like LAMP, loop-mediated isothermal amplification, or RPA, recombinase polymerase amplification. Compared to antigen tests, molecular POCT has higher sensitivity and specificity and can identify the pathogen genes or antibiotic-resistant markers. Examples include rapid PCR for SARS-CoV-2, Neisseria gonorrhea, MRSA, MET, age detection. The next category is microscopy-based POCT, where healthcare providers perform simple to moderate microscopy during the patient visit. This can include examining urine, stool, or other samples directly under the microscope. Another group includes host response biomarker tests, which don't detect the microbe itself, but measures the patient's inflammatory response. Common examples are C-reactive protein and procalcitonin tests. These help differentiate bacterial from viral infections, and it can also help to support decisions about antibiotic use. POCT can also be classified by the type of the device used. Some are handheld tests like glucometer, others are portable analyzers such as the iChroma2, and some systems are small benchtop instruments that function like mini laboratory analyzers. The choice depends on the clinical setting and how complex the testing needs to be used.
There are three classifications for clinical applications of POCT in microbiology, which are critical care setting, antimicrobial stewardship, and primary care and ambulatory setting. In critical care settings, there are three classifications, which are syndromic panel, sepsis management, and host biomarkers. First, syndromic panels. It uses multiplex POCT for respiratory tract infections such as influenza, RSV, and SARS-CoV-2. It rapidly differentiates between viral and bacterial causes, also determines necessity of medication. Second, molecular POCT is used for bloodstream infections and it shortens the time to result from days to 2 hours. It allows staff to quickly narrow and stop including broad-spectrum antibiotics once a non-resistant bacteria is discovered. Lastly, host biomarkers. C-reactive protein, CRP, or procalcitonin POCT, host response markers are used alongside POCT results to guide antibiotic discontinuation. POCT level often supports clinicians and physicians to safely stop antibiotics. Let's look at how POCT supports antimicrobial stewardship. First, through targeted prescribing. Point-of-care testing enables clinicians to confidently withhold antibiotics when they are not needed. In fact, studies have shown that incorporating POCT into primary care significantly decreases overall antibiotic prescriptions. Secondly, POCT contributes through rapid resistant gene detection. Modern molecular point-of-care systems can quickly identify key genetic markers associated with antimicrobial resistance. For example, POCT can detect resistant organisms such as MRSA, vancomycin-resistant enterococci, or Cabapiniamis, producing a look at how POCT is applied in primary care and ambulatory settings, especially under test and treat model. First is Group A Streptococcus aureus. In primary care, rapid immunochromatographic antigen tests are commonly used. These tests use a simple throat swab and can provide results in just 5 minutes, allowing clinicians to diagnose strep throat quickly and initiate appropriate treatment on the spot. Sexually transmitted infections. Modern point-of-care platforms use molecular nucleic acid amplification tests or NATs. These tests can be done using a vaginal swab or urine sample, and results are typically available in 30 minutes. This rapid detection is especially important for infections like chlamydia trachomatis and Neisseria gonorrhea, enabling immediate counseling and treatment. It plays a vital role in global health and rural settings. Here, rapid antibody or antigen tests are often used because they are simple, portable, and do not require complex equipment. Using oral fluid or a finger-stick blood sample, results can be obtained in 20 minutes. A common example is rapid testing for HIV, which greatly improves accessibility in underserved areas.
Integration of POCT with laboratory services ensure quality, accuracy, and proper follow-up. In this topic, POCT provides speed and convenience, while laboratory confirmation is still needed for complex cases, resistant profiling, and surveillance. Central lab also play a role in validating POCT results, managing data, and maintaining quality assurance. Now, let's talk about centralized data management. POCT results are electronically linked to laboratory information system and hospital health record. For example, Government Hospital of Malaysia are using HIS Elias KKM to manage their patient data. This ensures data visibility for clinicians and reduce manual errors and support consistent patient follow-up. Lab personnel will train POCT operators to establish protocol and perform routine quality check to maintain test accuracy. POCT device also must undergo regular calibration and their performance is monitored to meet regulatory standards. Integration of POCT into electronic records prevent transcription error and missing results, which are major post-analytical quality. Lastly, lab perform confirmatory tests for critical and complex cases such as antimicrobial resistance and pathogen typing. Also, validate the POCT result when necessary.